Good afternoon. Thank you for joining us for another update from our local medical community, our governments, and our community partners. I'm Brad Hart, Mayor of Cedar Rapids. I do want to begin by extending a heartfelt thank you to our healthcare workers and our first responders who really are on the front lines of this pandemic. They're putting their health in jeopardy to protect all of us, keep us healthy. We need to protect those heroes and their families by doing all we can, by staying home, do what we can to stop the spread of the virus. I also want to thank our child care workers, our grocery store employees, the truckers, everyone who's playing an important role in getting the services and the supplies that we all need in this crisis. Thank you to all of the city and the county employees who are continuing to provide those services that we need. I know that this crisis has really impacted a lot of people, financially, physically, and emotionally. We all need to continue to support each other as much as possible, but from a distance as much as possible. Parents, I know this is a difficult time to be a parent, but this is the exact time you need to be a parent. You need to keep your kids home and keep them safe. As you all know, everyone here has taken many steps to do what we can to help prevent and slow the spread of the virus. A lot of those steps are difficult ones to take, but we knew we had to make them. We have continued to look at and research additional actions that we could take to protect the residents in the Cedar Rapids area. It was recently reported that I was considering issuing an order, a local order for people to stay at home under some kind of vague powers that mayors may have under when there's a declaration of emergency. I did that. We did look at that and talk about that with our legal team because, as we all know, Cedar Rapids, Linn County has the highest number of cases of the virus and the most deaths. So we wanted to do whatever we could. After that additional research and speaking directly to the governor, it was really confirmed that in Iowa, cities and counties do not have the authority to close businesses or even to order people to stay at home. I know that the governor has the best interests of Iowans at heart, and many of the actions she's taken are equivalent to a stay-at-home or a shelter-in-place order. We will locally continue to look at all the options that we have to protect Cedar Rapids and our area citizens. One of those things we're continuing to enforce the existing orders, and Police Chief Wayne German will talk about that in those enforcement efforts in just a moment. I want to point out and thank all of the local restaurants and bars that have liquor licenses. Thank you for those who are doing the right thing and protecting your employees and the public. For all of you, I want you to understand that when your license comes up for renewal, that the City Council is given information on any violations the license holder has received since the last renewal. And I'm telling you that if there's a violation of the orders that are in place during this pandemic, that will play a really important role in my decision whether or not to support that renewal. So please continue to do the right thing. You know, the weather's getting better and everyone wants to be outside. It's great to be outside, but it's really important that we continue to practice social distancing. You need to stay at least 6 feet away from others and stay out of crowded areas. If you go to a park or a trail and it's crowded, go someplace else. There are lots of places in Cedar Rapids and in Linn County for people to spread out, and we really need you to do that. If overcrowding continues to be a problem and a risk for our citizens, we may be forced to close our parks and our trails like some other states have already done. I hope it doesn't come to that. Before I turn this over to Chief German and our other community partners, I do want to say how proud I am of this community. Every day I hear or see about other ways the community is supporting each other, from the hearts and the displays that are in windows, to people reaching out and making masks, to people still ordering food for takeout or delivery, or even buying gift cards from our local restaurants to help keep them alive. And to the community members and organizations that are working so hard to make sure that the elderly and those in need and our students are getting food and medicine and the supplies they need. I really don't expect anything less of this community. We do take care of each other in times of crisis. And in this crisis, it's really wonderful to see all those actions. So please, thank you and keep up that work. And finally, the now famous Dr. Fauci, I thought said it well the other day. We all need to act as though we have the virus and make sure we don't give it to anyone else. And with that, I thank you again. Stay safe, do the right thing, and I'll turn it over to Chief Wayne German.
Thank you, Mayor. Good afternoon. Since the governor's proclamation, area law enforcement, to include the Cedar Rapids Police Department, Marion Police Department, and the Linn County Sheriff's Office, have been doing business checks to ensure compliance, and officers and deputies have been actively patrolling city parks and other parks and trails to educate people about the importance of following these orders, and that these orders are meant to protect the health and safety of all Iowans. Several police officers have seen many people out exercising or getting fresh air in the parks and on trails. I think it's proven that exercise is an important aspect of mental health, and we'll likely see more people outside as the weather becomes nicer. While the playground equipment, ball fields, and ball courts are closed, the parks themselves and the trails are open. But it is important, as the mayor indicated, and I'll emphasize, that we continue to practice social distancing while inside the parks or on the trails to prevent the spread of this illness. As the mayor said, I think it's a testament to the people of Cedar Rapids and Linn County that the vast majority of the people are staying home and are only leaving for the essential purposes, such as going to the grocery store or picking up medications. At the same time, businesses and citizens have been compliant with the public health emergency proclamation requirements. In a few instances where a violation has been observed, officers have used it as an opportunity to educate those involved and to warn them. And in every situation, they have complied with the requests of the officers. We've not had to have anyone cited or had to proceed with formal legal intervention, although we are investigating seriously violations as they come to our attention. When we have seen a few individuals together, like 4 or 5 people, it's been mostly families or couples walking, running, or biking together. This is a public health emergency. The restrictions in the proclamation are being done for the health of each person who lives in our community and are best practices to stop the spread of COVID-19. Throughout this country and throughout Iowa, law enforcement has been asked to assist in the enforcement of the orders. Area law enforcement will continue to do that if necessary, but this should not and could not and cannot become a police or law enforcement emergency. Again, this is a public health emergency. This is about doing the right thing without having be told to do so. There were 2 significant incidents lately that occurred, one at Beaver Park and one on the southwest side of the city. I'm not going to elaborate at this time, but I can assure everyone it is not. Neither one of these incidents is related to the COVID-19 health emergency. So again, I'll close by focusing on the positive. And the positive is that our community is stepping up to this public health challenge, and we will continue to work with the public to ensure that we defeat this illness and ensure a safe community. And now I'll introduce Supervisor Stacy Walker.
Thank you, Chief German. And thank you, Mr. Mayor, for those remarks. On my way over here today, I learned that there were 2 additional deaths of Linn County residents, and I also learned that the state of Iowa has now eclipsed our neighboring state of Minnesota, a state that has a larger population than we do, in confirmed cases of the COVID-19 virus. I want to start by thanking all Iowans and Linn County residents especially for everything they've done to date to help flatten the curve. This has not been an easy process by any stretch of the imagination, and it may get harder going forward. Businesses are being shuttered, folks are getting restless in their homes, vulnerable communities are dealing with even more stress. We're starting to see loved ones become ill. Our world, in many respects, has been turned upside down, and all people want at this moment is a return to normalcy. But luckily for us, we have a roadmap that will get us there. If we continue to follow the advice of our experts, which we've repeated at these press conferences to underscore the importance of, we can expect to slow the rate of transmission, safely manage hospitalization rates, and minimize loss of life. It is important to remember, however, that we have community spread of COVID-19 at this time. This means any action with an individual anywhere in the community could be a possible point of transmission. But even with all of these measures in place, we know that it is likely this virus will still touch all of our lives. And with that, I have the unfortunate task of sharing with you that a Linn County employee has tested positive for COVID-19. And while I am prohibited from speaking to the specifics of this particular case due to HIPAA laws, there are a few things I can share with you. The building this employee worked in has been under restricted access to the public for 3 weeks. This employee has not been in a county facility since last Thursday, April 2nd, and due to the nature of their work, they had minimal in-person contact with other employees. The county facility in which they worked has been thoroughly cleaned and sanitized per CDC and public health guidelines and is safe for employees to work in should they choose to continue to do so. Public health authorities are conducting contact tracing, as they do in all confirmed cases, to identify any individuals who may have been in contact with or in close proximity of the employee to further monitor and assess whether any spread has occurred. But perhaps most importantly, the individual who contracted the virus is safe and is expected to make a full recovery. We are not the first government or large organization to have an employee contract COVID-19. And given the persistent nature of the virus, we will not be the last. And there may even be more cases in our government to come. And while I won't announce every case from this podium going forward, this hit close to home for us. This employee was one of our own, a public servant. And this incident further underscores, even for us, the seriousness of this pandemic. Here today we have Dustin Hinrichs, Environmental Quality Branch Supervisor with Linn County Public Health, and Garth Fagerbacke, our Facilities Director for Linn County. Dustin can answer any questions about guidance for companies and other organizations on how to safeguard their employees. And Garth can speak specifically to our enhanced cleaning and sanitizing regimens at the county. And I want to end by sharing with you something my grandmother would tell me often when times got hard. And that is, trouble don't last always. This is a common refrain in a lot of the old-time spirituals. I believed in those words then, and I believe in them now. If we do what we need to do, and if we do it well, we're going to be all right. Thank you very much.
Hi, I'm Drew Martell with Foundation 2, and I just want to speak briefly about mental health care in our community. The daily stress caused by the virus, social distancing, and a deep financial crisis is having a big impact on all members of our community. It is normal to have feelings of anxiety, isolation, and uncertainty during very abnormal time as we are now living. Prioritizing your mental health and staying socially connected is as important now as ever before. And if you or a family member or a friend are in need of support, please contact the Foundation 2 crisis line at 319-362-2174 or the Your Life Iowa crisis line at 1-855-581-8111. In addition to that, I want to provide some additional resources for individuals who might be in need of support for domestic violence, as well as the state's child abuse hotline. And starting tomorrow, April 10th, the Cedar Rapids Gazette is going to publish its coronavirus resource page for residents, which you will also be able to access. And again, that starts tomorrow. The domestic violence hotline can be reached at 1-800-770-1650. That's 1-800-770-1650. Additionally, you can text IAHELP, all capital letters, no spaces, to 20121. This is if you are in need of support for domestic violence. That is, text to IAHELP, all capital, no space, to 20121. And lastly, I want to share the child abuse hotline, which can be reached at 1-800-362-2178. That's 1-800-362-2178. During times of great crisis like this, individuals who struggle most with their mental health may not be able to reach out to support or may be unwilling to do so. So it is the responsibility of all of us to look out for those that we may have been concerned about previously. If you know a loved one or a friend that struggles with depression or anxiety, now is the time to reach out to them and see if they need your support. We have to be proactive in that regard. Thank you so much, and I will step out.
Good afternoon. I'm Ann Greenwald with Four Oaks, and I want to talk with you about how COVID-19 is impacting vulnerable kids and families served by Four Oaks and other social service agencies. To keep this epidemic from getting far worse and get Iowans back on their feet, both the social service agency net and the healthcare sector need to be strong. Examples of vital safety net services include providing childcare and basic needs so families continue working, reaching out to those in crisis to safely divert from law enforcement and from emergency rooms, keeping child safety first to prevent family stresses from creating harm and separation. Let me share with you 3 specific reasons why keeping our social safety net is strong is so critical now and after the epidemic begins to subside, along with what you can do. First, it's important to keep those who can be kept safe and healthy in our community from falling behind and even overburdening our healthcare system even more. You can reach out. Just as we're being asked to practice social distancing, stay at home, and be vigilant using our universal precautions, we're also called upon to help our neighbors and support our community. If you have concerns about family members, friends, coworkers, or neighbors, reach out by phone, email, text, or video conferencing to find out how this epidemic has impacted them. Just by the effort to show out that kind support, it reaches out and closes that isolation gap, and it also may lend to opening doors for further help. Second, we know from past experience that the trauma of this epidemic is impacting all Iowans, but particularly those who are supported by our community safety net. You can say something. During times of crisis, the standard way to monitor for safety are diminished. Kids are out of school, sports and medical routine appointments are being canceled, and families are isolated from work, friends, and neighbors. Since the start of COVID-19, as Drew said, child abuse reports and domestic violence reports are down. So we have to find other ways to check in and report concerns. If you see something, I echo, please call the child abuse hotline and the domestic violence numbers that Drew mentioned. Third, the full effects of this trauma will not be realized until after this crisis subsides, and overcoming the problems caused by this major disaster will continue for months and years to come. Our safety net worked during the flood of 2008 to prepare in advance for the efforts that would be needed to fully recover. And we're already beginning to do that again now. You can get involved. One example of the great collaboration to coordinate these safety net services and plan forward is Linn Area Partners Active in Disaster, or LAP-AID. It consists of 45 organizations who have come together to work on solutions to essential community needs. Go to linndisasterinfo.com to find out how you can help. Please lend your support by donating your time, your resources, and your voices to strengthen our safety net. And join me in again thanking our healthcare, first responder, and social safety net heroes. Thank you.
Good afternoon. I'm Dr. Dustin Arnold at St. Luke's Hospital. On behalf of the medical community, I'd like to give an update of both hospitals that the capacity of critical care is what we call green status, meaning we're sufficiently staffed and we have the ventilators and critical care beds that we would need in the event that a surge would start to present. That is done to multiple elements went into that planning, but one of the biggest contributions is that of the discipline of this community to stay at home, self-isolate, and practice social distancing. One of the questions that was delivered to the Department of Public Health regarding the hospitals was, what is the hospitals doing to prevent and protect non-COVID patients? We are screening visitors, restricting visitors, both hospitals, screening employees before and after their work shift, as well as we've postponed elective surgeries starting March 17th, and those will be postponed till after this event. That was not only to do safety and prevent the spread and transmission of the contagion, but also to reduce the amount of personal protective equipment that was being consumed. There's also been the establishment of 3 respiratory clinics in the community, 2 with Mercy, one out in Marion, and the other Marion, and they're establishing another one out at their clinic by Kirkwood. I can't think of the name of it right now, but right next to the Kirkwood Hotel. In addition, Unity Point Health has a respiratory clinic on the west side. I'd like to close today with my remarks to say thank you to the overwhelming support that we've received from the community, not only in practicing social distancing and reducing the transmission of the contagion, but also in the mask, the food, and the support has been tremendous, and the medical community is very grateful. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. I want to start off with a message from our friends at Linn Area Partners Active in Disasters. Fabric face masks are needed for child care providers in our community. Donations of fabric face masks can be dropped off at HACAP Corporate, which is located at 1515 Hawkeye Drive in Hiawatha, between the hours of 8:30 a.m. and 4:30 p.m., Monday through Friday. Individuals dropping off will need to ring the doorbell, as lobbies are closed for general walk-in traffic. This is a wonderful way to help protect children and child care providers. These providers are particularly essential during this response. As of today, there are currently 215 cases of COVID-19 in Linn County. There have been 9 deaths in Linn County. 76 individuals have recovered from COVID-19 within our county. The Iowa Department of Public Health has released updated guidance for businesses regarding COVID-19. Recommendations from the Iowa Department of Public Health include screening of all employees by taking their temperature and assessing for cough, sore throat, difficulty breathing, or any other respiratory symptom at the beginning and end of each shift. Exclude all employees reporting fever or respiratory symptoms. These cases will be directed to stay home and isolate themselves from other people and animals in the home until they have met all 3 of the following metrics. First of all, the individual or the employee has had no fever for at least 72 hours. That's a full 3 days without the use of medication to reduce fevers. And other symptoms have improved, and at least 7 days have passed since their symptoms first appeared. This exclusion criteria must be followed with all symptomatic employees, regardless if testing for COVID-19 has been negative or has even been done. So all ill employees need to follow those 3 metrics before returning to work. Additionally, report to the Iowa Department of Public Health when 10% or greater of your employees are reporting COVID-19 symptoms. For information on how to report, look at the Iowa Department of Public Health website. There is a reporting tool located on the website to help employers. Businesses should also consider excluding high-risk employees when outbreaks within their facility are occurring. High-risk employees would include people age 65 and older, and people of all ages with underlying medical conditions. As it's been stated earlier today, the weather is much nicer than what it was before, and more Iowans and Linn County residents are out riding their bikes, they're on the trails, and being physically active outdoors. Physical activity is important for your overall health, but it must be done responsibly, especially at this time. Social distancing guidelines should be followed outdoors as well as indoors. All individuals, including bicyclists, runners, trail users, should maintain 6 feet of distance between themselves and others, and not gather in groups or with other individuals outside of your immediate household. Even though you are outdoors, the virus can still spread to others. Everyone needs to do their part to slow down this virus. Social distancing should also be followed during religious holidays and other significant life events, such as funerals, birthdays, or other occasions. As we have stated before, the actions you take today will impact how long this public health emergency will affect our everyday lives. This concludes our comments. I think Caitlin is going to help us to prepare for any questions. Thank you.
As Heather mentioned, this concludes the end of the prepared remarks, and we will now have an opportunity for questions. For those of you that are watching, we have taken measures to increase social distancing here where we are conducting the press conference. So we did ask all of our media to be off-site. So right now I'd like to do a quick mic check. I understand that we have 2 questions. I think our first question comes from Shannon Moody. Shannon, could you just make sure we can hear you, please? Shannon, go ahead. Shannon, it looks like you're muted right now. We're going to move to. Oh,
Mic check. Can you hear me?
is it very good? Shannon, go ahead with your question.
My question might be best answered by Supervisor Walker. We have someone asking about how people who have disabilities or maybe immunocompromised. You're muted right now. We're going to mic check. Can you hear me? Very good. Shannon, go ahead with your question. My question might be best answered by Supervisor Walker. We have someone asking about how people who or maybe immunocompromised. You're muted right now.
Shannon, it looks like we're getting some feedback.
Shannon, go ahead with your question. This question might be best answered by Supervisor Walker. We have someone asking about how people. Sorry, I'm having a delay here, but how can people who are disabled or maybe immunocompromised, can't get out of the house for food or other items, how can they, what resources are available to them? How can they get help to get the resources and items they need?
I believe the question is, how can people that might be disabled receive resources? Is that what you're asking, Shannon? And Shannon, if you have audio in the background, it provides some feedback. So if you could turn your audio off in the background, that would help with the feedback. We're getting a lot of feedback in the room here.
Yes, that was the question.
Shannon, thank you for your question. I was unable to hear the first part of your question, and I think the second part of your question asked about resources available for individuals with disabilities. I know that Linn County Lifts is working really hard to serve vulnerable communities, including communities where individuals may have disabilities, to make sure those folks are able to access groceries and access critical appointments like getting to doctor's appointments or getting medication they may need. I also know that Linn Area Partners Active in Disasters is a really good resource as they coordinate with several different organizations in this community to make sure we are meeting the needs of all folks who are impacted by this. And lastly, 211 would be a good resource in general for people to access who may have special needs or unique needs, rather, during this time.
Shannon, does that conclude your questions? If so, I think we'll go ahead and move to Kate Payne with Iowa Public Radio. Kate, let's do a quick mic check and make sure that you're unmuted, and then go ahead. Can you do a quick mic check for us, please?
Yes, thank you so much.
Go ahead, Kate. Kate, please go ahead with your question. Oh, it looks like she's chatted her question into us, so I will go ahead and read the question that Kate has. Kate says, this question is for Supervisor Walker.
So this is for Supervisor Walker or the other county staff members who are there. Can you elaborate on how many other county employees may have been exposed to the employee who has tested positive?
I'll give this to Supervisor Walker for answer.
I'll actually let Heather answer this.
Okay. Heather with Linn County Public Health.
Kate, thank you for your question. For those that didn't hear it, Kate is asking how many other individuals may have been exposed. That is confidential information that we cannot release because you could potentially identify who those individuals are. So I'm sorry, Kate, I know that you're asking that, but according to Iowa Code, we cannot release that information. That is confidential. Thank you.
Kate, does that conclude your question for right now? It looks like it. I don't have another chat from Kate. Just going to do a quick check to see if we have any other questions in the queue before we conclude. Are there any other questions for our speakers today? Can I check with Michelle?
If you can hear me, I do have other questions.
Okay, is this Kate? Please go ahead with your question. Yeah. It looks like she's writing something. We'll wait a second for her to finish writing.
Yes, that's Kate. I think there's a delay, but yes, this is Kate.
Okay, go ahead, Kate.
If you all can hear me, again, on the employee who's tested positive, are you able to say if other county employees have been tested based on their contact with that positive employee?
The question from Kate is whether we can say that anyone else has been tested in regarding to that exposure.
Kate, thank you for the question about testing for anyone that may or may not have been exposed. So the guidelines for exposure, you're only going to be tested if you are showing symptoms. So anyone that may have been exposed anywhere, be that Linn County or any other business, we're going to be looking for symptoms. We are not testing people without symptoms at this time. So if someone is tested or not, that's between that individual and their healthcare provider after determining what that exposure was and if there are any symptoms present. So again, at this time, I cannot answer that, as those are conversations between the healthcare provider and individuals regarding Linn County or any other business. Thank you. Oh, sure. Yep. Go. Yep. Here. Go ahead.
This question also comes from Kate Payne. It says, can Heather update us on how many cases have been linked to Heritage Specialty Care?
So Kate, I can't answer that question for you. We have permission from Heritage to release that information. So for Heritage, 58 residents have been diagnosed with COVID-19. We've also had 30 staff members that have been diagnosed with COVID-19. Out of those residents, 12 of them have recovered. And out of those staff members, we know of at least 6 that have recovered and returned to work. So I hope that answers your question. Thank you. Oh, yes. Yep.
And I'll just have you repeat it.
Sure.
Are there any efforts to test asymptomatic residents or staff?
So Kate's question is, are there any efforts to test asymptomatic residents or staff? So at this time, the Iowa Department of Public Health, Linn County Public Health, the hospital-acquired infection team with the Iowa Department of Public Health, we are having daily phone calls with Heritage, and part of those phone calls is going over every single resident that is ill, going over what those symptoms are like, how they are progressing in their illness. We are also looking at every single staff member that is ill and what is happening there. We are working with them on personal protective equipment to make sure that they have enough of that on hand. So we're giving them quite a bit of guidance. It also includes guidance on cleaning. It includes guidance on keeping people separated. Part of that is looking to see who needs to be tested and who does not need to be tested. We have made sure that they have test kits for anyone that needs to be tested. And it's really on a case-by-case basis that we're working on. Like I said, we are having daily phone calls with them to assess the situation, to help them through this situation. Obviously, this is a very trying time for Heritage. These are individuals that care very much about their residents. They care very much about their staff members, and we are working with them to try to protect everyone that is associated in that facility. So we are really looking at it case by case to make sure that everyone is being taken care of as best we can in this very unfortunate circumstance. Thank you.
We have one more question from Kate. She's chatting it to us, so I'm assuming that she means that she wants me to read it. This question is for Mayor Hart or Supervisor Walker. Without a local shelter in place, are there specific activities or employers that you feel aren't adequately practicing social distancing?
Lots of people aren't performing and abiding by the social distancing, and they're not staying at home. I mean, a lot of people aren't. We've thanked those people, but there's still people out and about. We've talked about some of those cases. I'm not aware of, and I probably wouldn't name any specific businesses that I think are not doing all they can. We're just continuing to ask people to do all they can and give them ideas on what that means. Most of the community's doing it. If you're out in the streets, now you'll see fewer and fewer people in their cars. At my office, at the law firm, fewer and fewer people are there during the day. They're working from home, and when they're there, they're practicing social distancing. That's all we can do is keep asking people to do that because we don't have a shelter in place or a stay at home.
Thank you, Mr. Mayor, for that. I also just want to add on to those comments. I won't name any names of any businesses right now, but I can tell you an area of concern for me and others is large businesses that employ hundreds, thousands of people, even people working in confined spaces, and businesses that employ low-wage workers or refugees or immigrants. And doing the right thing by those employees to make sure that proper social distancing is happening in those businesses, and that they are being as accommodating as possible to allow individuals who may be ill to either work from home or to stay home until those symptoms reside. We need to do everything we can to prevent outbreaks, and so that means the private sector has to play their role as well in making sure they're doing everything they can to have a safe working environment.
This is another question from Kate. And this is for Dr. Arnold. Do Linn County hospitals have policies and plans in place to ration care if needed? For example, withholding ventilators from certain patients in order to prioritize others.
I can only speak for Unity Point Health St. Luke's, and the answer is unequivocally no. Not only do we not have that in place, we believe that our relationship we have with our patients, our palliative care program, as well as the resources we have dedicated, that would not be something that we would even have to consider at this time.
All right, that looks like that is the end of our questions, so that concludes our press conference for today. Our next press conference is scheduled for Monday, April 13th at 3:30. Just in summary, I'd like to briefly summarize our Linn County metrics. We're currently at 215 cases and 9 deaths. As a reminder, please practice social distancing, stay home when you're sick, and wash your hands often. Remember to stay safe and stay home. Thank you.